Hello everyone. In this lecture, we will be learning about Clincheck style treatment planning, one of the most important steps in clear aligner therapy. A successful aligner case does not begin with the first aligner. It begins with a well-designed digital treatment plan, and this digital setup determines how much each tooth will move and where attachments will be placed, whether interproximal reduction is required, and what is the final occlusion uh, will be like. Although ClinCheck is a Invisalign proprietary software, the principle discussed in this lecture applies to almost all the modern aligner planning softwares. Uh, Now, first, we have to understand what is a Clincheck. So, Clincheck is a 3D digital treatment planning platform used to design and visualize clear aligner treatment before fabrication begins. So, it converts patients' record into a virtual model and simulates tooth movement from the initial malocclusion to the desired final occlusion, and the software enables clinician to visualize tooth movement, plan attachments, schedule IPR, assess occlusion, estimate treatment duration, and determine the number of aligners. So it is essentially a virtual blueprint of the entire orthodontic treatment. The records required before treatment planning are the medical and the dental history, extraoral photographs, intraoral photographs, then panoramic radiograph and lateral cephalogram, CBCT when indicated, and smile analysis, Bolton's analysis, space analysis, and periodontal evaluation. So poor records do lead to a poor treatment plan. So it is important that the records are taken properly. Then the understanding the digital setup. So for that, the digital setup displays the complete sequence of planned tooth movement, and it shows the initial malocclusion, the final alignment, and tooth movement at each stage, number of aligners, attachments, IPR schedule, treatment duration, and final occlusion. And the software allows you to rotate the model and evaluate it from the frontal, lateral, and lateral, occlusal, and sagittal views. Um, mm, One should not approve a setup without reviewing every angle. Planning individual tooth movements. So each tooth movement should be evaluated separately. Review the alignment, crowding, spacing, rotation, tipping, bodily movement, that is translation, intrusion, extrusion, torquing, then arch expansion, midline correction. And tooth movement should always be biologically achievable. Excessive movements in a single aligner increases the risk of poor tracking and refinement. And planning attachments are important. So attachments are bonded composite shapes that improve force delivery. So what we have to review in the planning: how many attachments we are planning, that is a number, then what is the shape, size, and position, and tooth selection. The attachment definitely improves rotation correction, extrusion, torquing, control, root movement, and retention, and only use attachments when clinically indicated. Planning interproximal reduction, that is again one of the methods of gaining space. That is IPR is a short form. IPR creates a space by removing a small amount of enamel between adjacent teeth. So teeth requiring IPR, uh, which tooth will be on which tooth the slicing will be done, then amount of enamel, how much enamel has to be sliced off, and then timing is when and how much is important. So and how much space actually we will gain by IPR. So it should not be done blindly. Always confirm the sufficient enamel remains after reduction and avoid unnecessary IPR. Evaluating the final occlusion. In this, what we have to check is the final digital setup should produce a stable and functional bite. Evaluate for overjet, overbite, molar relation, canine relation, posterior intercuspation, midlines, cross-bite corrections, and open bite corrections. And a beautiful smile should always be accompanied by a functional occlusion. Do not review only the first and the last aligners. Scroll through each treatment stages and evaluate the tooth tracking, rotation corrections, space closure, attachment engagement, and root movements, and bite changes. This helps identify unrealistic movements from aligner fabrications. Some mistakes do occur when we are reviewing the digital setup. So, what are these mistakes? Let us see. Incomplete diagnosis, ignoring periodontal health, excessive expansion, unrealistic tooth movement, incorrect attachment placement, and excessive IPR, ignoring posterior occlusion, approving the setup without reviewing every stage, depending entirely on software recommendation. So the software provides suggestions, but the orthodontist make the final clinical decisions. And there are certain tips that can be kept in mind while uh, doing a digital approval. So before approving the treatment plan, ask yourself: Is the diagnosis correct? Are the tooth movement realistic? Are the attachments appropriate? Is the IPR necessary? Or is the final occlusion stable? Then a carefully reviewed digital setup is the cornerstone of success of clear aligner therapy. Investing the time in treatment planning minimizes refinement, improves predictability, and leads to better functional and aesthetic outcomes. So that's it, and thank you for watching. See you in the next lecture.